All right, wake up pre-health sharks. It is time for our weekly webinar. This time we're in the afternoon, but it's our weekly webinar of Wake Up Pre-Health Sharks, where me and two other experts from career development, we tackle pre-health topics and talk about different careers in pre-health. Today's a special edition because we have another expert joining us, Dr. Nicole Cook, and I'll let her introduce herself in a second. My name is Emilio Lorenzo. I'm the Associate Director of Employee Relations, and I'll let our two other career development experts introduce ourselves, and then we'll jump into the meat and potatoes of the presentation today.
Awesome. Thank you, Emilio. Hi, everyone. My name is Gabby Gross, and I am one of the career advisors for experiential education in the Office of Career Development.
And hello, everyone. My name is Danny Kraki-Suarez. I'm also one of the Excel career advisors in career development. And I know I have very reflective glasses today, so please bear with me.
That happens to me all the time with my glasses. And so, again, today's session, we're going to be talking about the epidemiology and covering a lot in that, being very relevant to what's going on today. And so, without further ado, I wanted to turn it over to our lead expert today, Dr. Nicole Cook. Maybe she can give us a little bio and her experiences in the field of epidemiology.
All right, well, thank you, Danny and Gabby and Emilio. Hi, it's nice to meet you all. Yes, I'm an epidemiologist, and we joke these days that, if nothing else, everybody knows what an epidemiologist is today, right? So my background is I've been with NSU about 9 years, and before that, most of my work was in community health centers, which is our nation's primary care safety net for the poor and underserved. And I spent many years working in epidemiology, health information technology, and disease surveillance, which is monitoring the occurrence and spread of disease at the health centers, at a national network of health centers. And before that, I did a lot of I used to direct programs and administer programs in healthcare across kind of the board: mental health, diabetes, asthma. I have a strong background in finance, which I think has been particularly helpful in being able to understand the current situation. So I went back in my late 30s to do my doctorate in epidemiology. My very last class in my master's program was epidemiology at NYU, and I really fell in love with it. And I kind of felt like if I ever get a chance to go back and study something for passion, it would be epidemiology. And I did have a chance to do that at University of Miami. So I graduated when I was 40. My husband and I both graduated with our doctorates when we were 40. And that's what I've been doing ever since. So I taught epidemiology at UM, and now obviously at NSU. I teach both in the undergraduate and the graduate public health programs. And I work in all kinds of areas across epidemiology and public health. So I do a lot of work in chronic diseases. I do research that spans nephrology to mental health, and obviously right now in the thick of it with COVID-19.
Great introduction to our topic today. And we're going to be putting Dr. Cook on the hot seat later on. We have a lot of questions for her to learn more about the field, and I'm sure students in attendance, as I mentioned, keep yourself on. We're going to turn it over to our students in attendance to ask their questions. Dr. Cook gave a great introduction and talked about her experiences. We did want to provide a brief summary of some terms and just some words you're going to be hearing as we talk and ask Dr. Cook more questions. What is epidemiology, you're probably wondering? Well, it's the study, prevention, and control of diseases or injury patterns in human populations. So during an influenza or disease outbreak, these individuals investigate the patterns or frequencies, the root causes, and try to control the spread of the disease. Epidemiologists consider various hereditary, behavioral, environmental, and healthcare factors. A great way of putting it is disease detectives. Dr. Cook, is that a good way of summarizing that career? I
think in terms of, as we talk about it today, this is perfect, not to mention a really nice slide, and I love your graphic. But I also think that epidemiologists, right now we think that the focus is really on infectious disease, and most epidemiologists actually don't focus on infectious disease. There's a whole section of us that do, but there's a whole section of us that kind of support ongoing research, clinical research, working with state and federal agencies to understand the distribution of chronic disease, because if we weren't living in COVID-19 today, most of the disease that plagues the United States is not actually infectious disease. It's actually chronic disease. If we were having this conversation 2 months ago, it would be a completely different discussion, because we'd be talking about hypertension, which affects 50% of Black adults. We'd be talking about diabetes, which affects, 8 to 15% of people over the age of 50. But because we're living in this Twilight Zone surreal scenario these days, everything is kind of like infectious disease.
Well, that's fascinating. So the chronic illness is something that's very common for epidemiologists to work into. That's great.
Yes, ADHD. I mean, really, you can take any disease and apply the methods that we learn in epidemiology to understanding that disease.
That is really cool. I did not know that. I think all of us on the panel today are learning a lot. A lot of people, and I think on this slide we've touched on it, that epidemiology sometimes is looked at as the cornerstone of modern public health. It involves research, practice, it relies on a variety of public health areas. So some of the things that I think you were mentioning right now, Dr. Cook, include biology, biostatistics, social science, even assessing the risk of exposure to a threat. Some of the education required to get into this degree, a master's degree or doctorate degree in public health or epidemiology, and some may require specialization, certifications, or experience in certain focus areas like cancer research onwards. Can you talk a little bit about this, Dr. Cook, and seeing as how, having a background and you having a doctorate degree, is this something that's very common in the field and ways to get their foot in the door? Or, have you heard of that before, being the cornerstone of public health?
Yeah, definitely. So, I think from just a contextual standpoint, it's important to remember. So public health in our country has traditionally been completely underfunded, right? So if we were looking back 10 years ago, most people would agree that you need an epidemiologist, like in every hospital, every large occupational organization, so factories, cruise ships, et cetera, that epidemiology plays a role. But because of our general underfunding of public health, we typically see epidemiologists either working in academic centers in research, and again, across the board research, or working as kind of like that straight disease detective, again, generally pretty resource constrained in local, state, or federal agencies. And those agencies generally limited to the CDC and the departments of health. Interestingly, and I know we'll talk about this later on, is that I think those days are over and everyone's going to be investing now in making sure they've got access to epidemiologists, and the funding will be there for that. But that's, so in terms of doctoral degrees, there aren't actually a ton of doctoral programs in epidemiology. They've really been like building up over the past 2 decades. Master's degrees, there's a lot of degrees in epidemiology or public health in general with focuses. And those focuses can be either epidemiology, infectious disease, GIS, so geographical information systems, is a really, really big complement to the practice of epidemiology today, and information technology, because a lot of what we typically did in the past with epidemiology, which is that constant going out, large electronic health records systems that are being put in place. So our ability to be able to do research and assess questions and generate hypotheses and test them are facilitated much more easily today with these very large health information technology systems. So that's another, I think, big area where we kind of see those synergies.
And some good trends I think you mentioned earlier about how COVID-19 is affecting the industry and even funding for some of these areas that may have not been there in the past. So some lucrative areas for those thinking and getting into a career in epidemiology. And I do know we have an information session for our master's program in public health at NSU. And so if you have an interest in that, that's going to be another great session for students to be able to learn more how to get their foot in the door in the industry.
Mhm.
So some key terms, just in case these come up as we get deeper in our conversation. I think in our next few slides, that's when we have a lot of questions for Dr. Cook to kind of get the conversation going. But I think you're going to see some of these incidents, the number of new cases of a disease or disorder in a population over time, prevalence, the number of existing cases of a disease in a population at a given time, cost of illness. So many reports use expenditures on medical care, so actual money spent as in terms of the cost of illness. Epidemic, something we've heard a lot of recently, a disease that affects a large number of population within a community, and a pandemic, an epidemic that spreads over multiple countries or continents. So again, two terms or few of these terms that we've probably been hearing recently. Anything you'd like to add on these slides?
No, you know, I'm looking at this and I'm thinking all the additional key terms that we're all learning these days: antibodies, antigens, transmission, viral load, right? So all these additional terms that have like been inundating us in the news.
Yeah. It's funny because probably a few weeks ago or a month ago, maybe these terms weren't so, you know, on the top of our tongue or recognizable as they are
Yeah,
today.
I have to say, I think I used flattening the curve once in my entire life until, you know, the past month.
That's really cool. And so I know our panel of experts have come up with some questions for you, Dr. Cook, and then we're going to turn over our participants, but I wanted to turn over to our experts so that they can ask you a few questions about the field.
Yes, and we're really excited to be asking you these questions, even just to learn for ourselves. And I have to say, with that previous slide about those key terms we're all learning, even in quarantine, I've been playing a board game called Pandemic with the people I'm quarantined with right now, and those key terms are helping me learn a lot and appreciate the field even more. So the question one that I would like to ask is, what experiences do you recommend undergrad students pursue if they are interested in pursuing a career in epidemiology?
All right, great. And can you hear me okay? Because I can hear like there's some lawnmowers going.
Oh yes,
Is
I
it
can hear
clear?
you.
Okay. So research is a big one, any kind of research. So epidemiology rests upon us being able to remove what's called bias in research, which means us being able to understand how valid our study is and how valid our results are, right? So we can think about this now in terms of like COVID-19 and the discussions that we've been having around, you know, we do testing. And so like, we know that there's a lot of false positive tests and a lot of false negative tests and people who really have symptoms and we're sure they have it, but you know, the test came back negative. So, you know, any kind of science really begins to build the building blocks around epidemiology because it teaches us how to understand the role of bias in research, how to understand the scientific method, and also how to understand this concept of confounding, which is such a big piece in research. Confounding being kind of really being able to understand the relationship between an exposure and a disease of interest, and understanding anything that might be getting in the way there of putting together that causal pathway. So any kind of research is important, and then any kind of like hard skills around statistics, information technology are also very important.
Great, thank you so much. And thinking about the research opportunities, I completely agree. And so in our office, we do these case competitions on a semesterly basis.
Yeah.
So you talking about the chronic illness research that you typically do, I think that would be a fantastic one for students to look at too.
Yeah, and I got to participate in the measles one. That was a lot of fun.
Oh, great.
Yeah.
Perfect.
We've had a lot of sessions talking about how to gain research experience, and I think Dr. Cook and Danny kind of reinforced those message of how important it is to get experience in research. And it's okay if your first research experience isn't in epidemiology. It's that research experience as a whole might help you dictate or find an opportunity that you do want down the road that is directly in the field you're looking for.
100%.
Into our next slide. Ooh. Back into the questions.
All right. So question 2 would be, what are those necessary skills to be successful in the field of epidemiology, since you mentioned they should gain some of those hard skills too?
Yeah, so again, because epidemiology is such this really ginormous field, right? If you're doing cancer epidemiology, if you are like an epigeneticist that's doing a lot of bench research, or if you're an infectious disease kind of epidemiologist out in the field. So it's a really big, it's a really big area to kind of answer this in terms of skills. But one thing that I would definitely say is critical thinking. Critical thinking is probably the singular most important skill that every epidemiologist needs. This is where we differentiate at the table from the clinician who has one singular focus, which is the individual patient, and the economist that has one singular focus, and that's the economy. Or I was just on a call right now, like with the commissioners and the health department. You know, everybody has their singular focus in the job they're in. The epidemiologist, this critical thinking, should be able to take all of these pieces from all of these different experts and help to put it together in a framework to move forward. So I feel really strongly about the role of critical thinking in bringing it to epidemiology. In addition to that, it certainly is helpful to have backgrounds in biology, if backgrounds in, again, information technology, to be able to understand those two, and definitely to have some kind of foundation in statistics. Not to be an expert in statistics, but at least to be able to read the medical literature. And that's a big part of what epidemiologists do, is we go into the medical literature and we try and understand what's the evidence base for our hypothesis. And then how do we develop a study that will allow us to truly answer a question? Because in epidemiology, we're not always asking, you know, we don't always have the easy answer to the question, right? So we're trying, again, to kind of pull in all of these different assumptions to be able to put the pieces of the puzzle together in order to be able to say, this is what we think is related to this particular disease, this particular exposure.
Perfect, thank you. Yeah, it sounds like a lot of puzzle solving with a lot of the crises going on. So that critical thinking comes into play big time.
Yeah.
All right. So question 3 is, what environments can professionals in this field find themselves working in besides maybe government agencies like the CDC?
Yeah, so it's a great question. Certainly the CDC, state health departments, local health departments. That's kind of like the first one. The second one is there's going to be, and there is somewhat of a role, but there'll be a much larger role for epidemiologists in occupational settings, right? Even as we're learning about the Navy and the armed forces and like that kind of whole story with what went on with the Navy ship that ended up disembarking in Guam, right? So definitely in the armed forces, there's a big role. There's a big role in bioterrorism efforts. Again, occupational settings, certainly hospitals. I also think that we see a big role in private industry. So the pharmaceutical industry has a very big role for epidemiologists. I would say it's pretty much ubiquitously across any kind of large healthcare organization, you'll find epidemiologists. So even our health insurance, like our Kaisers, our Atlantic Cares, our Cleveland Clinics, they have a number of epidemiologists. Now, they might not all be doing kind of this infectious disease, field work, contact tracing, but a lot of them are working with clinicians to help them take their research ideas from, into research to be able to answer questions. We also have epidemiologists that work on a lot of expert committees in terms of helping to understand how we take all of the studies that have been done and again, provide guidelines and algorithms for clinical practice. And I had one additional thought on what epidemiologists do. But I think that's it. It's really ubiquitously across research.
No, and that's great. Those are a lot of really good options for students to know that there are many places of location for employment after they do graduate with a degree like this.
Yeah, definitely. But I do think that to the extent that we supplement the epidemiology with either a very strong background in like health communications or GIS and or biostatistics, somebody becomes much more marketable.
Perfect. Thank you. And then question 4, what are some short and long-term challenges and benefits you hear and see from this profession?
Oh, I feel like anyone can answer this. Any person on this, we know our short-term challenge. I think our long-term challenge is going to be making sure that we remain an investment in public health in general, right? So it's not just epidemiology, but because we say that we're very interdisciplinary, it's really making the investment in public health. And in the past, we've kind of seen that investment whittle away, whittle away, whittle away. I'm hopeful now that we will no longer whittle away. You know, I'm sorry, I'm just going to go thinking about the previous slide. The other thing that I really believe we need are epidemiologists with training in finance and economics. Because if there's one thing that we've learned from the past couple of months is the incredible relationship to our public health response as it relates to our economic situation. And I think that there's going to be a much larger role of a way to be able to, you know, bridge those pieces. So the funds, you know, the funding's always going to be a piece. Certainly in America specifically, some of the big challenges we have with epidemiology is our insistence on privacy across everything in America. And, you know, if we look at how countries with national healthcare systems address the COVID-19 problem, and not just COVID-19, but addresses healthcare problems in general, we see that they do a much better job of prevention and a much better job of, there's a much higher level of trust. And particularly as we think about people being engaged and empowered to stay healthy, we really need that trust piece. And so perhaps the other challenge that we have is our extremely messy, fragmented healthcare system. That even if epidemiologists know what we need to do in order to improve things, we just have a very, very hard time kind of corralling all of the different priorities that are taking place in healthcare. So I am a huge supporter of healthcare reform. And I think that public health will continue to suffer very, very seriously until our country can move in that direction.
Great, thank you, Dr. Cook.
All right, so thanks, Danny, for asking the first couple of questions. And thank you, Dr. Cook. So far, my mind is blown with all the information that you're giving. I'm learning so much, and I hope, you know, everyone else is as well. So moving forward, the next question, what kinds of new opportunities are there for employment as a result of COVID-19?
Yeah, so I think we covered this, but honestly, if you just go to like Indeed right now, or a site that I really like is the Council of State and Territorial Epidemiologists. It's a job site, but that's kind of like the job site for epidemiologists. It's exploding. I mean, there are jobs out there. There are so many jobs out there right now for epidemiologists. New opportunities. Again, I think that not just in terms of infectious disease and contact tracing, which will, like specifically for COVID-19, will be taking place over the next year. Then we're going to move into vaccines. So everything around drug development, vaccine effectiveness, there's a whole role for epidemiologists there. Those are people with much more of a background in biology and chemistry and how they marry epidemiology. But honestly, I think we're going to see a whole new focus on mental health epidemiology, which is an up and coming and so important. I mean, this really is our biggest healthcare problem in America. We have, I think, 30% of people under the age of 22 suffer from a comorbidity of mental health. And so we're seeing a lot of new positions cropping up right now around epidemiologists with mental health. Certainly in chronic disease, the more chronic disease grows, the more we need people to analyze that data and come up with constructive solutions. So I think we'll see all that. In public health in general, a little bit outside of epidemiology, but still using those skills, we're seeing a lot of jobs out there around public health messaging, right? And development of materials, because we need a way now to reach people and educate them and encourage them to follow all of these new normal rules that we have around social distancing, et cetera. Can you still hear me okay?
Yeah, I still hear you okay. I hear it a little bit more in the background, but I hear you fine if everyone.
Okay, you don't need me to move? Okay. yeah, I think, as I said before, I really do think that epidemiology is going to explode. People know the value now. As the economy gets back into the workforce, we're going to need people who are going to be monitoring and addressing all of these issues. Keep in mind also, I'm sorry, COVID-19 is not going to be our last pandemic. The more that we have climate change and the more that we have overpopulation, we're going to have these new and emerging diseases. We already see it. We see it with dengue hitting America. We saw it with Ebola. We see it with some cases of, chikungunya. Like some of these diseases that were never really in America are making their way to America. And so there's going to be all of these offshoots for epidemiology to address all of these new emerging diseases.
Thank you so much. And this makes me very excited, especially as a career advisor. I love to hear that there's opportunities for my students, especially ones in biology or public health or any major if interested in this area. So yeah, thank you for that.
Mental health epidemiology, that was something I was really fascinated by. I never really thought about that, but it makes sense. One of the most pressing issues, not just here in this country, but everywhere. And just thinking about it within epidemiology and mental health, that's an interesting blend.
Mm-hmm. Yeah, and I think, epidemiology really has this very, very, very kind of like broad reach, right? So I'm an epidemiologist, but I do work in mental health. And I think I'm going to go inside because I think this might be getting kind of loud. Sorry. Guys.
Okay, no problem.
Sure.
And students, as I mentioned, I know we're going over a lot of great information. Once we get through all the questions, I'm going to turn it over to you to see if you want to expand on something we're talking about or ask your own questions, ask our experts any questions. But I think thus far, we've been able to cover a lot of great material. And I know myself and the experts were blown away by some of the topics that we're covering here. I think I had such a narrow understanding of epidemiology, and that's kind of expanding more and more into other branches I didn't know existed.
Yeah. I mean, I never, again, like I said, my background, I've never done contact tracing, for example, but I've done on the health information technology side, a lot of surveillance around sexually transmitted diseases, infectious diseases, et cetera. So it's a really, really broad field.
That's awesome to hear. All right, so our next question, I know we've touched on this a little bit, but what are opportunities for professional growth within this field?
Yeah, again, I mean, it would be moving up within academia, Department of Health, pharmaceuticals, healthcare insurance plans that really, we see those countries, those few countries. I think it's Taiwan. I think the vice president of Taiwan is actually an epidemiologist. The people that have training in epidemiology, I do believe that the sky is truly unlimited today. And it's sad. By the way, this doesn't make me so happy. My husband was just laughing. He's like, oh my God, isn't it the most exciting thing in the world for epidemiologists, COVID-19? Not at all. I mean, because we're public health people, we tend to be, pretty sympathetic and empathetic. And this does not make me happy what's going on in the world. I would much rather be able to work on something much quieter than what we're dealing with right now. But the reality is that we are in a new world today, and that new world is going to continue. And again, once COVID-19 hopefully goes away, whether it's through a vaccine or whatever that might be, there will be another emerging infection that comes along. So I think opportunities for growth are fairly exponential. Now, I will say that I think, again, the opportunities for professional growth are really tied to that additional skill set that you can offer outside of epidemiology. So whether it be nursing, physicians, a strong research background, biology, chemistry, health information technology, GIS, and those are the ones that are coming to mind right now, although there may be others. But being able to marry either some kind of like really strong technical skill or some really strong clinical skill with epidemiology really positions somebody much better for growth.
Perfect, thank you. I think we mentioned that a lot as career advisors for students to really take opportunities, even if it's not necessarily in their field, because you never know down the line it could really assist them. So it sounds like that's really prevalent in this field right now.
Yes.
Awesome. Okay, so our next question, I know that we've also talked about this a little bit more too, but what are some typical job titles and types of careers to pursue? Maybe any that you may have not mentioned?
grant writers, analysts, again, health information technology people. I don't think you'll find a lot of people with the term that are called epidemiologists outside of federal, state, and local agencies, and or the armed forces, and maybe some hospitals. Generally, I think you'll see other terms. And a really big emerging term that's coming out right now is population health. So there's a lot of jobs right now in population health, and population health is like this incredibly beautiful mix of epidemiology, health information technology, and clinical understanding. And that is absolutely exploding. That field was exploding before COVID-19. That field has been exploding over the past 2-3 years. And it's the perfect marriage, again, of epidemiology. Now, there are master's degrees specifically in population health. There's also, but most every position for population health will require a strong background in epidemiology, a strong training.
Okay.
So we can go more into that if somebody has a question, like specifically in terms of what population health is, but that's like a whole hour of explanation outside of this. So just,
Another Wake Up Real Sharks edition.
yeah, it's really cool. It's a really cool area.
Dr. Cook, I've seen a lot this week being posted at the CDC on public health advisors, government agencies posting public health analysts or public health officers. So I think that goes with what you're saying. I mean, I think there's been almost full pages of opportunities being posted within the last few weeks.
Yeah, 100%. I mean, those positions are out there, part-time, full-time, all of it. Yeah.
Perfect. Thank you, Dr. Cook. So our last question for you, and I know you've been, doing this the whole time, but what advice do you have for students who are interested in pursuing the field of epidemiology?
Yeah, so passion is obviously the biggest thing. You mentioned it. Any area that you can get yourself into research, do that. It doesn't matter if it's research in something you're interested in or not. It doesn't matter even so much if it's public health research or bench science. But to the extent where you can get experience in research, that will definitely help you. Along with that would be presentations, publications, grant writing, would all help. And then, of course, to build up those additional skill sets around statistics, clinical backgrounds in chemistry, health information technology, et cetera.
Perfect. That's all great advice. Thank you so much.
So I think that was all the slides that we had, but we wanted to turn it over to before we talk about our services and how career development can help you out with this, I wanted to turn it over to see if any students had any questions or feedback, anything else that you wanted to talk about. So if you want to raise your hand or unmute yourself, and you could throw a question over to our experts and Dr. Cook.
Hello, hi, I do. I have a question.
Perfect, Jessica, go ahead.
Okay, is there any specific a way that epidemiology can specialize for kids, like to kids, or?
Yeah, I mean, certainly if you're not working as a general epidemiologist, what you would probably find is that if you were to look for jobs like within the CDC or look for jobs specifically in research, those are all targeted towards specific interest areas. So for example, like pediatric oncology, right? So there's like a whole area of pediatric oncology, and within the research network of pediatric oncologists, you would have epidemiologists. So they may not, I think in terms of field epidemiology and contact tracing, there you're really much more generalist working in infectious disease. So if you're working for a health department and you're one of those disease detectives that's kind of going out into the field, you're really part of a group of people that just responds, right? The same thing at the CDC, they're called epi-intelligence officers. But if you're more interested in going down that research route and not kind of that hands-on field epidemiology, then absolutely, Jessica, you pick the area that you're most interested in. And again, you know, one can say that what you're interested in is research. What epidemiology offers you is the methodologies to be able to conduct research that can hopefully be the most valid and the most valuable in driving evidence. So that's why we have a lot of physicians that pursue a master's degree or a PhD in epidemiology. Does that answer your question?
Yes, thank you.
Sure.
Great question, Jessica. Any other students have questions, or any guests that have questions for Dr. Cook?
I have a question.
Hi, Jade.
What is the difference between I think it's a doctor PH or a PhDR versus a doctorate degree with a PhD?
Yeah, that's a great question. And I'm not really sure I know the answer to it. I think there are DRPH programs that specialize in epidemiology. I don't know. It might have something to do with the dissertation, but honestly, I don't know. By the way, Jade and I are working together on a small research project. So
Oh, great.
it's been a lot of fun. Yeah, I don't know. I did a PhD in epidemiology, so I don't know that I've looked into the different programs.
I don't know exactly either, but I think it has to do with the dissertation and the research involved.
Yeah.
Program.
That's what I've noticed mostly so far. I'm already looking ahead. I'm only in my first year right now in undergraduate, but I was looking ahead towards my major and getting my doctorate. And then I saw that that was an option and that you wouldn't have to go ahead and do a dissertation. But would you still have the title of a doctor if you did a DRPH?
You would. I'll tell you what I would probably do is not go straight to a doctorate. I would do a bachelor's degree, see if you can find a job with a bachelor's degree, even just doing some kind of it's really hard, and at least, and things might be different moving forward. But in public health, everyone, regardless of education, pretty much starts at the bottom level.
Okay.
So it's almost better to get your foot in the door in any capacity, and then to build your way up while simultaneously building up your education. So I would never recommend, in fact, I don't know, I'll be honest, I don't know anyone who graduated with a doctorate in public health or epidemiology that was able to find a job out of academia without real hands-on job experience. I don't know, Gabby and Danny and Emilio. These jobs require hands-on experience to move up the ladder. And while the master's degree is required for any kind of management position, just as important is that hands-on work. So that's my feedback.
Yeah, a blend of two things. I think we've talked a lot in the last webinar about gaining experience, and what you said, Cook, is exactly what we iterate. Start small. Like when you're undergrad, gain some research, even if it's not apples to apples with the research you want to do as a full-time professional with your master's degree. Start slow, build up your resume, gain experiences, find avenues to build transferable skills. And then you're going to get to the point where you have enough experiences where you can go for the more lucrative opportunities, those summer REU programs in a direct area you want, or providing part-time or full-time positions in grant-funded positions or full-time jobs that are of interest. But I think it starts with baby steps of gaining some level of experience, and then that door is going to open wide for you to find other things that you directly want.
Yeah, I think the fellowship's a really important part. I think that, again, I don't know what the world's going to look like going forward, but the job picture for epidemiologists and public health in general differs by state. I think, Jade, we spoke about this a couple weeks ago. So states that invest more in public health will have more jobs like these and like others. And states that tend to be a little bit stingier on healthcare, Florida being one of them, tends not to have as many jobs and tends to really start people small. And then you kind of have to build up again those experiences and that education to move up the ladder. I know people, and again, it's a little bit of a different world. It's going to be a little bit of a different world next year than it is today, because there's going to be so much federal funding coming down for emerging disease surveillance and monitoring and contact tracing. But I know people who have had to take their master's degree off the resumes in order to get their foot in the door. I literally don't know one person who graduated with a doctorate that didn't have hands-on experience that was able to get a job outside of academia. They simply won't hire. So I would never pursue a doctorate unless you know exactly what you want to study and you have enough experience where that doctorate will help you get that next job.
So what about a fellowship or an internship to start out with? Say, if I went to the CDC in Atlanta and started working for them, as you know, or maybe part-time, and then could I still work? Do you think I can work for them at the same time while going to school? And this way, if I applied, I would have my bachelor's degree, but then continue my education, say in Georgia at, let's say, Georgia State University, and continue my education in public health there for my master's, and then maybe further my degree because I'll have more experience of what I might want to do.
Yeah, absolutely. I mean, I would look for because you know what you want to do. I would start now looking at any kind of fellowship or internship you can get, state, local, federal with the CDC, any of it. The other thing that I would really strongly encourage, and again, I didn't do my doctorate until I was 40. And I had 3 little kids at the time. I think they were like 2, 5, and 7 when I finished. And I was already a senior director at an organization making a salary, which it wasn't practical for me to then kind of leave and go to the CDC in some kind of not entry level, but some kind of role that, you know, wasn't going to pay the salary I was already being paid. But if I was doing it all over again and I knew what I wanted to be when I was your ages, I would become a public health officer somehow with the federal government. I would go into, I would get trained, Army, Navy, Air Force, Marines, National Guard. I would follow that route because if you're a public health officer, your jobs are absolutely unlimited. So, you know, Gabby, Danny, Emilio, you have a much better sense of this in terms of how those jobs are protected in the state and federal agencies across the board at Human Services Resource Organization, AHRQ, CDC, all these organizations that hire epidemiologists and public health people. Those jobs are prioritized first for people that have served. And so if you know that what you really want to do is, you know, become one of these epi-intelligence officers and you're not going to medical school. Okay, if you're going to medical school, you got a leg in, or nursing school. But if you're not going to medical school or nursing school, the very best thing you can do is to somehow find your way into that system.
Okay.
And we do a lot of sessions. We actually had the CDC at our last career fair. We've had a lot of different government organizations, but these are things that we've talked about. And I think you talked a lot about when you're evaluating graduate programs, really evaluating before jumping into one, gaining some experience, creating some momentum for yourself. And there's a lot of avenues to do that. But I think doing informational interviews with people in that field and how they got to their road, or looking at LinkedIn profiles of people that are in positions you can see yourself down the road, it's going to show you a little bit of a roadmap. And I think every profile, every interview you do, or every conversation you have, you're going to see that there's a lot of roads to that end goal in working in that field of epidemiology.
Yeah, I think that's a really good point. You know, this isn't the forum for Career Day because I've done that before, but you know, my road to get to where I am is, I don't know anyone else that kind of had, you know, my career trajectory, because I started out in finance. That was my background, finance and pharmaceuticals. It wasn't public health. But had I known what I wanted to do at the age of 18, I would take that knowledge now, and I would have either gone to do the Peace Corps, or I would have gone into the armed forces, and that would have given me a leg up for every single public job that's out there.
And so I think a lot of the things that we've talked about today is a perfect transition into how you can learn about internships, jobs, how you can explore if epidemiology is for you, applying to grad programs. We have different opportunities just here at NSU for you to get involved. So our NSU Career Development Office, you can see steps here on how to set up an appointment, talk to an advisor. But I think today we went over an amazing topic. I know I learned a lot. I hope our participants learned a lot. Want to thank Dr. Cook for taking time out of her day to share her insights, share her experiences, be able to answer our questions. We put her on the hot seat, and she really opened our eyes to all these different opportunities in this industry. And so wanted to thank you, Dr. Cook, for joining us today and being able to share all your knowledge on the subject. Oh, Dr. Cook, I think you muted yourself.
Thank you so much. Nice to meet you all. So I'm going to log off now, yeah?
Yeah, thank you
Okay.
so much.
Take care.
You.
Bye-bye. Thank you.
Bye.
And for our students, thank you so much for joining us today. Know that we host this every week, and you'll get a recording after we're done. But all these sessions are for you. So if there's any topic you think would be of use, please send it our way, and our experts will jump right into it. But thank you again, and appreciate you joining us and being able to hear some of the insights that we have for the session.
Thanks for joining us, everyone. Oh, and a student Ashley just asked, where can I access them later? So we do send the Mako Career newsletters. Amelia, if you'd like to talk on that.
Yep. So bi-weekly, we send Mako Career newsletters, which has these webinars on them. But we're going to find a place for them on Handshake so that you can access them. And then every morning, so tomorrow morning, you'll get it. And that's our recording of Wake Up Pre-Health Sharks. So we're going to be every week diving into a new topic. And next week, we're going to be tackling how to write a personal statement.
Awesome.
So thank you all for joining us, and tune in next week for our next topic.
Thanks, everybody.
Bye, guys.